glory. Hallelujah. Well, welcome everyone. We welcome you to the Pure Partners Virtual Fellowship. We are Elders Maurice and Kim Johnson, and it is our pleasure to come to you with Pure Partners every Sunday. If it's your first time watching us live stream, we want you to know that we appreciate you. The word PURE is an acronym that stands for prayer, understanding, reinforcement, and encouragement. And that is what we come to do on every Sunday evening. We are the appetizer. You get your spiritual food in the morning, and then you come home and get you a good meal. And we are the appetizer / dessert. So we just want to seal the deal in fellowship with the word in every area of your life. So we are so excited for you all to be here today. And
again, we want to say welcome to everyone coming in. We are so blessed and honored that you're in with us today. And like my wife said, we're just appetizers. I know we had an awesome word from our pastor, Apostle Harold K. Brown, Sr. at Faith Mission Ministry in Clarksville, Tennessee. We had an awesome word on today, and I'm sure you had an awesome word that's on today as well. But right now, we're going to go into a great segment, and my wife, she's going to introduce our speaker on the evening.
Yeah, so I am so excited today. You know, here at Pure Partners, we cover all 5 areas of ministry: spirit, soul, body, social, financial. So we deal with every part of who you are and how we operate. So we are so blessed that as it relates to our health, our physical health, that we have a subject matter expert in that of Dr. Vicki Nunnery. And before I read her bio, the one thing that I appreciate so much about her is not only that she operates in excellence in what she does medically, but she has a heart for the people. She wants to see you be well and see you live. And so when she agrees to donate her time to do this, that just to me speaks a lot of her character, even before I read the bio. Because a lot of people have all the schooling and the education, but they don't have the heart for God or for the people. So I'm so honored to know her and to have seen her, that what she says lines up with what she does. But I'm going to go ahead and read her bio. Dr. Vicki Nunnery has been a registered nurse since 2006, in which she graduated from St. Xavier University in Chicago, Illinois. She joined the United States Army in 2006, where she was initially stationed at Tripler Army Medical Center. She later began her critical care nursing career in the intensive care unit. She also has been stationed at Fort Bragg, North Carolina, in the ICU and served as company commander, HHD 28th Combat Support Hospital. Dr. Nunnery was deployed to Iraq in 2010 and Afghanistan in 2013. In 2017, she graduated from Uniformed Services University of the Health Services with her doctorate in nursing practice. She currently serves at Fort Leonard Wood, Missouri, as the battalion surgeon, serving as provider of initial entry trainees. So we're getting ready to have her come on, get the questions together. But without further ado, I present to some and introduce to others, Dr. Vicki Nunnery. Ma'am, are you ready?
I'm ready. Thank you guys once again for having me. I really enjoy being on here and answering questions and bringing my knowledge to you and whatever knowledge you have back to me. It always goes vice versa. So once again, thank you guys. When I was going over my notes and stuff, it's been since March since we talked about COVID, and a lot has gone on since then, right? So I wanted to kind of touch on some of the previous things that we talked about a little bit, but I also want to bring in, a lot of the updates that's happened since we have a lot more research and a lot more news that's been going on since then. So I'll start off by going that we have 181.1 million people that are vaccinated. So that's a lot. However, it's really only about 54% of our population. So we still have a lot to go with getting people vaccinated. And that goes along with, of course, people's fears, which we can definitely understand, and with the new knowledge that we do have. So getting that knowledge out to people is the best way that we can do. And this is one of those avenues. And that's why I like coming on, to get that knowledge out to others. So just to go over, I know everybody wasn't here before, to get a little basic knowledge of the vaccines that we do have. Of course, there's 3 vaccines. We have the Pfizer, Moderna, and the J&J. For the Pfizer and Moderna, they both are what's called mRNA vaccines. And what that means is that part of the virus is allowed to go into our bodies. It's not live, but it allows to go into the body, and the body uses some of that protein from it to be able to build knowledge into ours, and so our body knows how to remember to fight it if we were to get that virus in the future. It's a lot of the myths that people out there believe that vaccines prevent us from getting the actual virus, and that's not true. So you can still get the virus after being vaccinated. However, because of the effectiveness of it and our bodies responding to it to build what's called our B and T lymphocytes, our body knows how to respond to that virus once it enters into our cells. With Pfizer, we know that it's FDA approved now for 16 and older. It's still under research for 12 to 15, so be aware of that. However, all of them are very effective. And it's still the 2-dose for the Pfizer and the Moderna. And then for the J&J, that one is also effective, but that's a different one. It's not the mRNA like the other 2, it's a vector. And what that means is a modified version of the virus, and it allows it to shed within the body. The thing about this one that people get a little bit nervous, affecting our DNA. None of these vaccines go into our DNA at all. So they can't touch it, and that way it won't change your body or change who you are. So be aware of that. The J&J is still a 1-dose vaccine, unlike the other 2. So if you do get 1 dose of J&J, that's considered effective, where you don't have to go back and get a Pfizer or Moderna. They don't recommend cross vaccinations with different brands. So if you get that one, then you're just 1 dose and you're good for right now. With J&J, there still is research going on about that one because it did come out a little bit later. So we're kind of still waiting for that to come out to see if we need a booster for that one. For the other 2, well, for Pfizer for right now, there's a booster recommended. And that's usually right now for 65 and older, or those who are immunocompromised. As far as the general population right now, they're holding off on everyone getting the booster. But those who do have underlying conditions, 65 or older, or immunocompromised, they are recommending that booster, which is also available right now. And from what I've heard, many people haven't had any issues with that booster. So hopefully that we continue to have that same thing. As far as what's new with COVID vaccines, they are recommended for pregnancy, and they are recommended for people who are breastfeeding. That part right now is not FDA approved, but they're still working on research. From what I've seen though, people haven't had any issues as far as getting pregnant with the vaccine, complication during the pregnancy, or complications while breastfeeding if they receive the vaccine. However, they are seeing a lot of people. I don't know if you saw recently in Mississippi, they've had about 8 or 10 people who were pregnant that did die from COVID that were unvaccinated. So we are seeing a lot of people who with pregnancy that are unvaccinated that are dying from the virus. So I highly recommend it. I know it is sketchy because I know if I was pregnant at the time, I would be on the fence as well because we still have limited data, but they are recommending it for those who are pregnant to protect you and the baby. There are some myths out there about what the vaccine has in it. As far as the fetal cells with Pfizer and Moderna, when we think about all of our research, there are some fetal cell lines that are used in the very, very beginning of research. However, in the actual vaccine themselves, there are no fetal products. And so that's something that people are using right now for their religious exemptions or medical exemptions. And so just to put the information out there, those do not contain that. As well as those who are holistic and don't like animal products, it does not have gelatin in it as well. And so there are no eggs, there's no latex, no preservatives, there's no metals like iron, things like that. And so people who have any side effects or allergies against those, they can be safe to take these vaccines as well. So if there's any questions about that, those are also available. If you look up the actual vaccine ingredients, they will say that none of those are listed in them. One of the big things that came out earlier this year was the side effects that we were seeing. Of course, there's a lot of side effects with medications, vaccines. We all know that nothing's 100%. However, the big things that we noticed with Pfizer and Moderna was the myocarditis and the pericarditis. And what that is the inflammation of the lining around the heart or inflammation of the heart itself, the muscle. And so with Pfizer and Moderna, they're seeing that mostly in our younger male population, usually after that second dose. Symptoms with this include chest pain, shortness of breath, and some palpitations. However, with myocarditis and pericarditis, these are usually easy to treat. Usually some anti-inflammatories, some fluids, some bed rest, and usually they're able to respond really well to that and usually don't have any restrictions once this period has surpassed. Of course, they're followed by cardiology to get released back to activity, but it shouldn't stop them in future endeavors, especially if they want to continue on with sports or anything like that in the future. For the most part, it shouldn't stop them. The other thing that we did see in the news was J&J with the thrombosis and thrombocytopenia, which is basically either blood clots or low platelet counts. And so they did do like a brief hold in their research, not a hold in research, a brief hold as far as giving the vaccine until they did a little bit more research, and then they resumed it. And so what they noted was younger adult females, usually under age 50, were the ones that came up with this mostly. Side effects with this was usually I saw some headaches, some shortness of breath, some chest pain, leg swelling, abdominal pain, and some easily bruising. Now, this can be a little bit more significant. The blood clot is not identified quickly. And so this was more concerning, which is why they did stop giving the vaccine until they had more research. But right now they're seeing that they're seeing less of this, but it's still something that to be aware of if you get the J&J vaccine, especially that younger adult population of females. So a few other things to go along. They're still using that website. So if you do get the vaccine coming up, make sure you use the VAERS website, VAERS, for your side effects. So we do have that data for everyone else if things start to show correlation. For those before, we did mention that if you got other vaccines that you had to wait 2 weeks before getting another one. So there is no gap anymore between getting your COVID vaccine and any other vaccine like shingles or pneumococcal or flu or anything like that. And then while I said flu, make sure you get your flu vaccine this season when it comes out. I haven't seen anyone advertising it yet, but it is probably usually late September, October. So most communities should start getting it, but we highly recommend getting the flu vaccine if you haven't done that in previous years. The other thing that we'll talk about as far as like after vaccination in our variants. So I know we've heard about the Delta variant right now, which is our most common one that's mostly deadly right now. And for variants, a lot of questions about how the variants change. So as our virus continues to spread, it allows the opportunity for the variant or the virus to develop new variants and kind of change and adapt itself. And the only way to really stop this is to really reduce our virus rates in our transmission, which is why we have the hand washing, the mask, and the vaccines. So the more we get people vaccinated, theoretically, we should stop having less increase in incidence of people getting contracted with the virus, and then we should see less variants develop. Hopefully, that's the goal. However, they're still monitoring it on a daily basis when it comes to the variants. So there's a lot of them out there. They don't always report all of them because either they're similar to what we have now or they're not as deadly. Right now, the CDC is monitoring 4 variants. There's Alpha, Beta, Gamma, and Delta, of course. With the Alpha was first noticed in the UK. With the Beta, it was first noticed in South Africa. Gamma was first noticed in Japan and Brazil, and then the Delta was first noticed in India. And the reason why you don't hear about the other ones too much is because we haven't seen many of those variants in the US. And with Delta, that's about 99% of what we're seeing right now. And it's the most deadliest, it's easily transmissible. The biggest thing about this one is some of our treatments aren't as effective. And that's why we're seeing increased deaths with Delta, because the things that we have available that we've been able to treat in the past are no longer as effective with the Delta. And they're still trying to develop more things that become more effective with it. And if you go back and look, the variant that we did have back in January of 2020 is actually no longer detected in many of our testing today because that variant has changed so much. And that's why you're seeing more transmissions and more sicklier with the COVID as we continue to progress, because that one from a whole year ago is not the same one that we're seeing today. So be aware of that, and that's why they're really pushing vaccines to be able to kind of stop these variants from occurring, because we don't want them to become more deadlier and more transmissible as we go along. A few more things that I will say that for, I think I said this already, but for the booster for J&J, we're still not having any information right now about that as far as going forward, but I think in the future they will have that probably next couple of months as they get more information about that. And then late sequelae, they're still developing treatment plans for that. I know we talked about this before, but that knowledge continued to evolve for those who had mild or moderate symptoms of COVID and still 3-6 months later still have some signs and symptoms or some complications from that virus. Usually it was more the shortness of breath, the chest pain, the body aches and weakness. People still continue to develop those. So they're still developing plans on how in the long run to treat those. So I'm thinking that the CDC and the WHO guidelines will have that come up in the near future as well. Now we have more research. The other thing was depression, because COVID, can really strain your life, your family's life, especially those who have had lots of deaths in the family. And so there's still lots of behavioral health available that I do recommend that we all try to seek for those who have lost, different family members and who are still going through COVID, because COVID is unlike any of our other viruses that we've ever had. And so we're seeing different effects, especially those that are affecting those who can't go back to work immediately, like someone who had mild symptoms. And so definitely use the resources that are available in your community and within your healthcare system. So that's all I have. I just want to kind of give you guys an update and give you guys some knowledge on new things that's come out over the past year. So I do want to open up for questions if anybody has any. Thank you.
Amen. Awesome. Thank you, Dr. Nunnery. So we're getting ready to open up for questions. That was great, a great update dealing with COVID. I wanted to talk a little bit about, and then we'll take some questions. I wanted to ask about the Mu variant. Did you mention, was that one of the ones that you mentioned?
Which one?
It's called the Mu, MU or something.
I haven't heard of that one.
Okay.
That's the new one.
It may be something that so I just want to know if you had heard that come out. It was just some report.
No, I just kind of track the ones that they're really worried about right now as far as the big ones that the US is looking at. It was only the top 4 that I mentioned. They didn't really mention the Mu. Okay. It may be out there because the Lambda is out there. They're different ones. But I know that the US is only tracking those big 4.
Okay. And then thank you so much. I am so glad that we're having this conversation before we transition, because I know that there's a lot of fear, and there's a lot of false information out there, and even a lot of providers that are putting out false information. So thank you so much for covering that. So before we go to something else, I guess we can just see who has questions related to about the virus. Did you have anything? Does anybody have any questions or want to make any comments as it relates to the virus? If you do, you could just take yourself off mute. My husband is watching the live stream, so if anyone has anything.
This is,
I guess,
go ahead, dear.
Okay, so I guess I have two questions. So, well, one statement. So I just, for me, with the mask mandate, how they're trying to, or this president is trying to mandate vaccines or mandate, masks and things like that. I understand the mask, but for me, it just bothers me when I see a paper where it says, or you can go to this concert if you're vaccinated. But if you're unvaccinated, you have to show proof of, I guess, negative COVID results. When I see that, I just think about, okay, with being vaccinated or not, you can still be a carrier, you can still transmit it. So I think for me, that's frustrating, seeing that, because I feel like if you're going to make, some people wear masks, then make everyone wear masks, because vaccinated or not, you can still transmit it. You can still give it to other people. And both, with being vaccinated and versus, not being vaccinated, you can still die as well. So I think that for me is the frustrating part of seeing that. So that was my first kind of statement. And then the second is, as far as being vaccinated, it just bothers me a lot, because it seems like the government can come up with a vaccine for this in minutes, it seems like, but there's been other cancer, HIV, AIDS, things like that's been around for 40 plus years, and it's still no cure or still no vaccine. So that's what kind of bothers me.
I will say for the mRNA, even though it seems like it came out pretty quickly, the research and the underlying study behind it has been going on for decades. So they've been trying to do different things with the mRNA for a while. And I guess it just took for this to be able to take effective. Now that they do have this study with going on with mRNA, they are trying different things with it. I know they are doing an HIV study right now to try to do some things. An initial part has been somewhat effective. And so I'm not sure why the things before didn't work, but it has been going on as far as the research with mRNA for at least the past 10 years.
Gotcha. Okay. Thank you.
You're welcome. I know there is some cancer research as well that's been effective. I forgot the lady's name, but she's still waiting for a lot of funding. And so hopefully if she gets the funding and she can go into clinical trials, then maybe we will see something with cancer being cured.
Thank you.
Man, thank you, Kayla. Dr. Bree?
Okay, couldn't unmute myself there. First of all, thank you so much for having this program, because there is so much misinformation out there, and people are confused, and we've got to get to the point where there's not so much confusion. Otherwise, as the nurse said, these variants have the potential to get more deadly as they occur. So thank you for having the show. And what's the young lady's name again?
Vicki Nunnery.
Ms. Nunnery. Thank you so much. You made it so clear, and you broke down some information and gave some information that the average person does not know and hear. I wish there were more people on, but you did an excellent job. Thank you so much for your diligence in following this and for your willingness to update us on.
I appreciate that.
Really good. Thank you so much.
Amen.
Amen. Anybody else have any comments or questions
on that?
And while they're still thinking, Dr. Nunnery, I just want to say, first, I want to thank you for coming on and all the research and knowledge that you have shared with us. And like Dr. Bree said, I wish more people was on here, because we need to know this information. Still going on, he say, she say, but going on some doctor say knowledge, medical knowledge, as wisdom as well. Just not knowledge, but wisdom that you gave us. And so I do appreciate you coming on and sharing with us.
And just a
Thank
thought
you.
on the COVID before we kind of shift. Um, can you just talk about just some of the symptoms and symptoms change now with the new variant? Is there some different things that we should be looking for as symptoms that you could have it than we did before?
So it's still the same symptoms. What we are seeing though is not as the fevers and the headaches and chill with some people. Now we're seeing just a cough or runny nose. And so sometimes it makes it hard. Well, is this our regular summer cold that we're having, or is this COVID? Especially with our children, right? Because they come home with runny nose all the time. So I think that's the hard part too, because with the Delta, it is easily transmissible. So I may just come home with a runny nose and cough. I may not ever have the headache, the chills, and the fevers and things like that. So it is difficult to kind of in the beginning tell if it really is COVID or not. And that's why people are starting to get an uptick of running to get tested because the symptoms are so similar.
Okay, awesome. Thank you for that. And so, as we're getting ready to go into fall and winter, I know you spoke a little bit about the flu shot. Any other preventative things that we can do? And we have a lot of the holistic doctors and people that feel like the whole thing with the COVID is about your immunity and just making sure your immunity. Can you speak a little bit to that? Because it's almost as if some of the information they're pushing out is as long as you're taking these vitamins and you're eating right, that you should not get it. Can you kind of speak a little bit to that?
Sure. I mean, we can sit here and build up our immunity all day, you know what I mean? But there's still nothing to say that I have the best immunity, but I still can get a virus. So you still want to work on, sleep, hygiene, making sure that you're washing your hands, wearing your mask, washing your hands frequently in between doing certain things. Make sure you're exercising, eating right, taking your, vitamins and zinc, elderberry, turmeric, ginger, whatever you decide to do. But there's still no guarantee that you won't get the virus. The biggest thing is kind of, if you can, do social distancing as much as possible. However, it's hard because many of us are going back to work. Many of us, still are traveling and doing different things, going to different events. So if you can limit some of those things, being around people, that was probably the best thing that you can, along with getting the vaccine, the flu vaccine. But like I said, you can build your immune system up all day. It doesn't guarantee you from getting the virus. It helps your body fight it though. So if you do take those things, I mean, I believe in elderberry. That's just my thing, and zinc. And so, but it doesn't say that I won't get sick. Like my son, he in daycare. So he went there, got the daycare crud. I got it. I didn't think it was COVID. So we just kind of stayed at home and treated it. But like I said, I do different things holistically as well. But yet I still got sick. So you can do whatever you can, but I would try whatever steps that you can to eliminate getting COVID and remove, different things, no traveling as much as possible. Don't go to big environments. A lot of people is crowded. Wear your mask when you're in public. Those are the biggest things that we do recommend.
Okay, thank you. All right, so if anybody have any questions, y'all just hit me in the chat or just come off mute. The next thing I wanted to ask about was gut health. And this is a transparent moment because I'm kind of dealing with some issues and I've read up different things about it. And I had a couple other questions come in about this. Can you talk to us a little bit about what gut health is and how it affects, energy, or how it affects, with keeping your weight at a good point, because you hear a lot of things about probiotics and all these different things. Can you talk a little bit about gut health?
Okay, so I have limited knowledge with that. What I will say is gut health is very important. And there's a lot of books and research coming out about gut health and what we do know about it. With the probiotics, it's hard to say because they're not really sure which ones are the best ones. So you can go to Walmart or Target and you look down that aisle and it's like 10 different probiotics and prebiotics. And so there's nothing right now that they could say specifically on which ones are the best ones. However, I do recommend it. But like I said, I really can't say which ones are the best one or how much you should have per day, but it does help. They are saying that gut health does holistically help the entire body as far as how you break down things, how you fight different inflammation, how you fight different infections and things like that. And that goes along with clean eating as well. So a lot of things that we do eat go against our gut health because it has the increased preservatives and increased saturated fat and things like that. But I do recommend probably looking more into it. Like I said, I'm not really big on it. I only know a little bit about it. But I do know they're doing a lot of books and research on the microbiome and gut health.
Awesome. Thank you. Anyone else have any other questions? Any in there? Okay, what's the question? Can you clear up some of the misinformation about the mask? All good questions. Bishop Kirkland, yes. So he's saying, can you clear up some of the miscommunication about the mask? You know, what's the best mask? And there is a lot out there to try to figure out what is the best mask. What does it look like?
So when it comes to masks, I would say that I stray away personally from a cloth mask. And I do wear pretty much we call it like the hospital mask, hospital grade ones. I think those are the best because of what happens is the pores within the mask. Now that's the best way I can explain it because viruses are so big and those pores allow to block certain things from getting into the mask. And that's how you're protected against it. So cloths, I don't really prefer them. I prefer basically the hospital grade ones. Now, when it comes to people thinking they have to wear an N95 mask, that's not really necessary unless you're in close contact within a hospital setting with a patient that actually has an airborne disease or COVID or droplet precautions and things like that. So typically the regular masks are typically, I think was okay, best to wear versus the cloth mask.
Okay, thank you for that. And then when you're wearing the mask, because I see this and I'm like, and I have to make sure too, it's supposed to cover. Now, the hospital grade mask, because I remember we used to get fitted for those. I can't remember the name of them.
N95s.
N95. So that's the same N95 that you can buy like at, I think someone said they have them at Home Depot or something.
Yeah.
Is it the same N95?
It is, but people aren't fitted for them like we are.
Oh.
And so that's a little different. So when we're fitted, we're making sure that there's no leakage around the seal. And so if you're just going off the street buying a mask, you're just buying whatever size you think you fit. And so you're not really paying attention if you're leaking out around it at all.
Wow, that's good. Okay. All right. Lady Queen says that there was excellent information and she will be wearing her mask. She is not opting out. She's not going out without one.
Do it. I wouldn't go out without it either.
Because I do think people think, well, I got the vaccine, so why should I have? That's their thing. If I'm getting the vaccine, why should I have the mask? But the vaccine doesn't mean you're not gonna get it.
Right. And no one said that vaccine was 100%. If you look at it in the very beginning, it was still 95%, 96%. No one ever said that the vaccine was 100%. Even with flu vaccine, that's not 100%. So you still have to protect yourself against it.
Yeah, that's good. All right, any other questions? Well, I'll just kind of share my personal testimony about the whole vaccine thing. My husband, I've been getting the flu shot for years, not even think about it. We had to, it was our job. You got the flu shot or you didn't work. I mean, you had to get the flu shot. Or you had some type of excuse or underlying thing. And so my husband got the vaccine first. And to be honest, I had listened to so many things and I was just like, I don't know, I'm not, And he kept asking me over and over, concerned, and I had some events coming up. And it really took me to a place where I really was just seeking the Lord about it, just in turmoil, because what happens when your mate gets it and your mate believes, this is what we should do. And I'm wanting to be in agreement with it. But to be honest, I had that fear that came over it. Many of you may have known we had, between the both of our families, we had 12 family members that passed away from COVID last year. So, you know, I just had all kind of things going on, prayed about it. And then, you know, my husband was praying over me. He never pushed me, but of course he was concerned. My friends, people were saying stuff. But the one thing that I realized that for me, and everybody has to make their personal decision about it, was that I had to have faith with it or without it. It's not 100% either way. And I just knew, and the Lord just resonated it with me that it was going to be okay. Now, I'm not going to say it was like I'm on board. It took me a minute, but I just think that if we could just respect people's point on it. I've been in rooms on Clubhouse where people are almost in screaming matches over about this vaccine. I've heard teachers that were quitting their jobs up north, and because they did not want to take it, and everybody's so emotional over it. But I really just pray that we all would just honor each other in whatever decision, and just trust. And we're gonna have to trust God at the end of the day, either way. So, have you experienced that with patients that come in that are kind of torn about it, and then you're put in a position where you have to kind of help them make a decision, or they're going back and forth about it?
I mean, I'll say from personal experience, I was the same way, because initially they were concerned about people having issues with infertility. And, you know, I have one child and I want more children. And so I was on the fence. My husband went and got his because he was like, I'm getting this vaccine for the very jump. But it took me a few months. And, you know, even though while I was still working, I still was, you know, looking at research, trying to see what they're saying about fertility and, you know, if there's any issue people were having and what was going on. And I didn't really get it until like the end of April because I really wanted to make sure that it was the best decision. But at the same time, I really had to fight with it and be like, either do I, you know, want to risk, you know, not being able to conceive another child, or do I want to be here for the child that I do have? You know, so I had to make the decision, and I wanted to make sure that I took care of my family, protecting my son who couldn't get the vaccine because he's young. So that was the fight that I had between myself and how me and God kind of talked it out. And I eventually got it and didn't have any issues. So, you know, praying to God to have no infertility issues going forward. But I do have a lot of patients who do, you know, in the beginning have questions about it, especially those who are immunocompromised. You know, and I tell them the same thing that I dealt with, like, you know, do you want to be here with your family members, you know, and be able to fight the virus if you get it? Or do you want to, you know, be in the hospital bed wishing at the last minute that you should have gotten the vaccine to help your body to fight it? And so a lot of people did go on and get it and didn't have any issues or complications from it. And then the thing about it is now you're seeing a lot of people who are on their deathbed saying, you know, get the vaccine, get the vaccine. And so we do have to fight for that. But it is a battle within yourself. And there's nothing you can say against anybody until you're ready. But it's having that knowledge, and that's what, you know, this forum is for, is to really have that knowledge to say, this is what I want to do, versus someone forcing it down your throat. And I will say for, you know, military people, because, you know, it is mandatory for us now to go ahead and get the vaccine. But what they're doing is, you know, if you have a good reason enough to be medically or religious exempt, you still get counseled, so you have all the information available to you, and they're approving some exemptions. So it's not like, you know, we're getting it shoved down our throat either if we have good reason. But as long as you have all the knowledge to say, this is why I don't want it, a lot of times they're getting approved.
Good. Once again, we thank you for that wisdom. And like you said, everybody had their own personal reason why. And I know my wife, you know, just to share, when my wife kept asking me, you know, and I kept asking her about getting the vaccine, and she was like, Maurice, why are you pushing so much for the vaccine? And I just had to share. I said, because, you know, because my father passed away from COVID, and he didn't have the opportunity to get the vaccine, you know, and so that was one thing that was in my mind, you know, why I went ahead and made sure I got it, because some people that passed away last year didn't even have the opportunity to make that decision, or may have a choice. And so that's one reason why I'm an advocate for the vaccine, you know, and make sure we get it, because like you said, it's not 100%, but it can prevent some deadly issues per se. And so that's why I say we want to thank you for coming on and sharing with us the knowledge and wisdom about the vaccine, and that also to let us know that it's still no guarantee. It's still not 100%. You know, so once again, we thank you for that.
Thank you.
Any other questions or comments? All right. So again, we thank you so much for coming on, Dr. Nunnery. You always bless us, and we look forward to seeing you again towards the end of the year. We normally have her on once a quarter with the latest and the greatest for us and different topics. If you have a topic or something that you think that we can discuss here and you want to ask her, we can send it to her before time, and she'll come back and be able to share with us. I just thank God just for your humility and wanting to do it, because at the level that you're doing things, it's just such a blessing. People, you're so down to earth, but people have no idea at the level that you were. I know because I work with you, but I'm just honored that you would even take out the time to come and just to know you as the person. Now, Caleb didn't get to make his president yet because he normally gets to make an appearance once a quarter.
He's asleep right now.
Oh, is he? Okay.
Yeah.
Okay. We missed him normally because his appearance.
Yeah.
Thank God for
one next month.
Oh my God, has it been a year?
Yeah.
Lord help us.
And congratulations to your Bears today.
Yes.
Yeah. There we go. There we go. All right, but before you go off, we're getting ready to go into our announcements, but I wanted to do something while you were here, something that we just want to do not only for you, but for we wanted to say a big thank you to all of the frontline workers, whether you're a doctor, a nurse, teacher, whatever your capacity is. On behalf of the Pure Partners, we wanted to take this opportunity to say thank you, that we appreciate all that you do. If you never get another thank you and never get a pat on your back, we want you to know that we appreciate you, because we're not out of this pandemic yet. We're still working. And guess what? The pandemic isn't the only thing going on. There are people that are having issues with all other kind of things. And you guys don't get to take the breaks that many of us get to take. And I just wanted to say, my husband and I and Davita, and on behalf of the Pure Partners, we wanted to thank each and every one of you for what you do. Dr. Nunnery, definitely thank you. And we definitely wanted to give honor to the ones that have given their life for the cause. We had some teachers here in Clarksville that passed away from COVID, but those all over that have given their life for the cause. And even we're talking about our service members too, active or veterans. They're frontline workers. They work to protect us. So this is our heartfelt thank you. And thank you for your service. Thank you for your labor of love. And we just want to say thank you today. So thank you, Dr. Nunnery, for coming on.
Thank you so much.
Yes, and we look forward to having you back on before the end of the year. Any final thoughts before we end?
No, just take care of yourself, take care of your family. That's all I can say. That's the biggest thing.
Awesome. And if you want to sow into the woman of God for her time, we definitely will. I will put her Cash App. I will put her Cash App in the chat box, so you can send us a message saying that you want to. And that she doesn't do this for money. She's not doing this. This is something that she's just doing, but we just want, she's just here to be a blessing, as she always is. And we just want her to know that we appreciate her continuing to be consistent and coming on. So thank you, Dr. Nunnery.
Yeah.
All right. Well, we're getting ready to get into our announcements. And we're going to do a couple of slides, and then we're going to turn it into our awesome administrator, prayer warrior, Elder Davita Shaw. So next week, we have First Lady Helen Igby that'll be coming on. And I know I'm probably not pronouncing it right. I think it's Igby. that'll be coming on. She's out of Leeds, Nigeria. Awesome, powerful woman of God. We had a session a couple weeks ago about evangelism, help wanted, and she's going to keep that fire going, talking about that we are to be the salt and the light. And I tell you, once you hear this woman of God, you're going to know exactly what we're talking about being the salt and being the light. So that's on next week. Excited about that. All right. And this, we have, look, these people haven't even hired us yet. Okay. So we are promoting this movie. And even though the people that made the movie are from my husband's hometown, we have become their advertising people for this movie. And the movie is Show Me the Father. Baby, you got something to say?
Yes. I tell you, this movie right here, we had an opportunity to go see it yesterday, and it was just God that led us through, because Ken was doing a podcast interview yesterday morning, and the young man that interviewed her, he's like, "Hey, Elder Kim, you and your husband need to go see this movie." And it was yesterday morning, and as soon as he said it, I started looking it up, and I looked up the first time for the first show, and we had the opportunity to go with some friend of ours to the movie. I tell you, this movie will impact your life. Yeah. I tell you, it would cause you to change the way you think about fathers and your Heavenly Father as well. Yeah. So once again, like Kim said, they even haven't hired us or anything like that, but due to the move of this movie, we recommend that you go see this movie, Show Me the Father.
So it's in theaters. It's available now, and it was fantastic. And this was the first movie we went to since February 2020, and we brought Lysol and we had our mask, and it wasn't really nobody in there, and we had a good time. So I'm just saying. All right, so we just wanted to tell you about this movie, and we're gonna turn it over to our awesome administrator, Davida. Go ahead, Davida.
Hello. Amen. So we want to share information with you regarding the Bella Group. As some of you may know, the Bella Group is a women's support group for those that are dealing with trauma. The next session is starting Friday, October the 8th at 6 p.m. Central Standard Time, 7 p.m. Eastern Standard Time. And this is an awesome platform for those that may need help dealing with trauma that you may have suffered. They have some great help that could benefit you. So if you know of somebody, or if you yourself desire to be a participant in the Bella Group support group, please share this information, or please call the number that's on the flyer, and we will get all of that information to you. I'm telling you, it is an awesome support group.
Okay. Men, get ready wherever you are. If you're a father, grandfather, uncle, nephew, son, we will get ready to end the quarter on the men's virtual in-gathering, Men Check. The title of this segment is Men on the Move, and let you know that we are on the move for the kingdom of God, that we are sold out. We have 3 awesome speakers, Bishop Curtis Whaley, Man on Fire, Elder Milton Johnson Jr., Man's Money on a Mission, and Pastor Rasheen Howe, Man of Faith. Join us, men, October the 16th at 9 a.m. Central, 10 a.m. Eastern Standard Time. You can go on Eventbrite, up on the Men Check to register. Registration is free. I tell you, you do not want to miss this opportunity. Go ahead and register so you can join us on October the 16th. Thank you.
And women, you are not forgotten. Our last women's in gathering for 2021 is going to be on Saturday, November the 6th at 8 a.m. Central Standard Time, 9 a.m. Eastern Standard Time. Please go to eventbrite.com and register. It is free. The theme for this ingathering is not by might, not by power, but by my spirit, saith the Lord, coming from Zechariah 4:6. If you've been to our ingatherings this year, you know that they have been awesome, and you do not want to miss this one. There is going to be 4 awesome speakers that are going to share the word of God. Lady Sheila Taylor, Kalia Johnson, Lady Queen Hill, our own Faith Mission fam, and Prophetess Roberta Hatch. So spread the word, share with somebody about the women's ingathering, because you don't want to miss this.
Yeah.
And if you are looking to be a part of a book club, Empowered by Him is the book club for you. It is for the women. And our own co-founder, Kim Cherian Johnson, is the founder of the book club. And it just not just so happens, it was voted unanimously that our next book would be her book.
Yeah.
And so we will be getting our new book on October the 2nd at 6 p.m. It is virtual. If you desire to be a part of the Empowered by Him book club, please go to Kim Johnson Empowers. She will give you all of the information for you to be a part of this awesome book club. And if you want to purchase a copy of her book, you can also go to Kim Johnson's Empower at Gmail to get a copy.
Yeah.
And also, we want you to spread the word about Pure Partners. Let them know about Pure Partners. It is our desire at Pure Partners to reach beyond just our local. We want to reach globally. And so you can help us do that by spreading the word, letting them know about our Sunday virtual meetings and our women's ingatherings, the men's checks. Spread the word. Even the Bella group, even the book club, spread the word. You can go to our Facebook group, Pure Partners. You can go to our Instagram, Pure Partners for You, our YouTube channel, all of those outlets, and spread the word about Pure Partners. Also, if the Lord so lays on your heart to sow into Pure Partners, please do so. And you can do so via Cash App, Zelle, or PayPal. And all of that information is on the slide. And we thank you in advance for spreading the word about Pure Partners. Also, it is Pure Partners' honor to pray for you. That is what the P in Pure Partners stand for, is prayer. And so we would like to pray for you. If you have any prayer requests, please feel free to take yourself off mute and let us know, or you can put your prayer request in the chat. Because as I said, it is our honor to pray for you.